Welcome to the Doc Talk. Today's episode is on all things sleep with sleep expert and social media star, Dr. Sujay Kansagra. You're definitely going to want to stay tuned until the end of the episode to hear our guest's sleep prescription for all of you. Enjoy. Hi, everyone. Welcome back to the Doc Talk podcast. I'm Dr. Shazma Mathani.
And I'm Dr. Sheila Wijayasinghe.
How are you doing this week, Sheila?
Well, I'm okay. I'm actually super excited about today's talk because sleep has been an issue my whole life, but it feels more so this week, which I think is just my body getting ready for our talk today, which I think is going to be so helpful for so many of our listeners. So we're talking about sleep today.
Yeah, this could not have been better timed. I'm like coming off a string of evening shifts. And so I'm so excited to chat with our guest today. So without further ado, this is a podcast that everyone's going to want to listen to because I think there's going to be a tidbit in for everybody. So today we're so lucky to have Dr. Sujay Kansagra, who's a professor at Duke and the director of Duke University's Pediatric Neurology Sleep Medicine program. Dr. Kansagra is the author of numerous peer-reviewed research publications and 5 books, including the book My Child Won't Sleep, a high-yield step-by-step guide to fixing common sleep issues in children of all ages, infants through adolescence. He's currently doing research on novel technology that helps with behavioral insomnia of children. Dr. Kansagra can be found on any social media platform as @ThatSleepDoc, where he has over 500,000 followers. So we are so thrilled to have you here today, Sujay. Welcome to the Doc Talk.
Thanks for having me. Really excited to chat about sleep.
Yeah, I mean, I've been following you for ages. You and I have done a few like little collaborations together, just where we like send video clips back and forth, and you've been so great. We've talked about jet lag, we've talked about melatonin. Sheila and I had a quick chat earlier this week, and like we were very easily, like within 2 minutes, able to come up with a list of questions to ask you. So we're really excited to have you here and get your expertise.
Yeah, no, really looking forward to it. So much to talk about sleep. And, I wish we had like hours upon hours, but, I know we don't. But yeah, really excited to chat about it.
Awesome.
I think that's what's beautiful about what we're doing today is that we're going to be able to distill it down, hopefully in the next 30 minutes or so for folks to get what they need to get started. Because I know when I work with my patients, it's one of their biggest issues is sleep. I do a lot of perimenopause, menopause work, and it's definitely an area that's quite a concern. So Sujay, a lot of our patients come in and ask about sleep. And when somebody comes to see you, I think one of the biggest questions that we get is like, how much sleep do we actually need day to day?
Yeah, it's a great question. I'll tell you, in my clinic, I'm seeing predominantly children. So it's the need for sleep is changing over time. We know that in the first year of life, if you had to look across that entire year, things average out around 14 hours of sleep per day. But the range of sleep, which is, I think, really important to understand, is so wide, and everybody has their own different genetic predisposition for how much sleep they need. And so at 1 month of age, the normal ranges could be anywhere from 9 hours every 24 hours, all the way up to 18 hours every 24 hours. So it's a really wide range. By the time we hit adulthood, the typical sleep need is somewhere between 7 and 9 hours per day to feel fully refreshed.
And does it change as we get older, like into senior age?
Yeah, so some people believe that as we continue to age, once you hit adulthood, there's not too much more of a decrease. But some would quote the normal range for elderly folks, I wouldn't say elderly, but folks in their golden years tends to be a little bit less than your younger adult.
So when you say that there's a range there, because I've like certainly heard you say this and read about this as well. So how do you know as an individual if you're someone who's on the higher end of needing like kind of closer to 9 hours of sleep, or how do you know if you're someone who needs closer to like 7 hours of sleep?
Yeah, that's a great question. At the end of the day, it comes down to really how you're functioning during the daytime. So in the absence of having quality issues with your sleep, if you're getting good quality, there's no issues with sleep apnea or restless leg, et cetera. Well, then in the morning, there are a couple of different criteria. One, it shouldn't be painful to wake up. Waking up should not be a painful process in which you have a tremendous amount of what we call sleep inertia. Sleep inertia is the you experience when you wake up, right? You want to continue to sleep. You shouldn't have a tremendous amount of that impairing you from getting up and going. Ideally, you should be waking up before your alarm clock goes off, because if your alarm clock is shutting down your sleep, it already tells you that you could have been sleeping more. So that's a clear sign that you're not getting the sleep that you need. And number 3 is, how do you function during the day? Do you need coffee to stay awake? Do you have a tremendous lull right after lunch where you feel super sleepy? Those are all signs you might not be getting the adequate quantity or quality. But if you're doing everything right, you should be waking up before the alarm clock, not needing extra stimulants like caffeine, and feel alert and awake throughout the day.
Okay. So getting up and not going back to sleep and hitting that snooze button is...
Yes.
Yeah.
The snooze button is like the sleep inertia button, right? It's like, I just can't get my body up and going. I need that extra time. And that's like a clear-cut sign that you're not giving your body adequate sleep opportunity at night.
Okay.
So you mentioned kind of quality of sleep a little bit. And, we know that there are different phases of sleep, like the ones that kind of come to mind are REM sleep, deep sleep, light sleep. So how much of each phase of sleep should each individual be getting?
Yeah, this also changes quite a bit as we age. When we're young, we spend a lot of time in both REM sleep and that nice, sweet, really deep, what we call N3 sleep. And then as we get older, we tend to spend more time in the lighter stages, N1 and N2 sleep. By the time we're adults, usually REM sleep occupies roughly 20-25% of our night. Deep sleep can be around 20-25 or less. And then the vast majority is usually in N2 or non-REM stage 2 sleep, which is kind of middle ground when it comes to depth. At the end of the day, people are always kind of worrying about, well, my sleep tracker told me this is how deep my sleep is, etc. And I encourage everyone to take that with a grain of salt, because unless you have an EEG strapped to your head that directly leads into your tracker and they're analyzing your EEG patterns, there's no great way right now of distinguishing the different stages of sleep or the depth of sleep. So really it comes back down to, what does your brain tell you regarding how you're feeling, not necessarily what your tracker is telling you regarding how you're feeling.
Well,
so can we take a little, take a little side note, talk about trackers, exactly.
Because we both track our sleep.
Yeah, there's so much can be said about trackers, because at the end of the day, trackers are great for raising awareness, regarding your sleep. And sleep has become, this more popular topic recently with health and wellness at the forefront of many people's minds. So it's great to tell you, okay, this is about how much you're sleeping. Trackers are actually really good at distinguishing wake from sleep, because they're typically relying on accelerometers. If you have something on your wrist and it's moving a lot, chances are you're awake. And when you stop moving, chances are you're really relaxed or you're asleep. So it's pretty good at distinguishing wake versus sleep.
Does it look at things like heart rate as well, like to kind of decide what phase of sleep or whether you're sleeping or awake?
Some of them do. And so Some of the more sophisticated rings, like the Oura Ring, can take into account heart rate variability. I think they even take into account pulse oximeter, which also correlates with different stages of sleep regarding how much variability you have in your oxygen levels. And so the trackers are getting better. The technology is getting better. But it's rare that I've seen them actually put this up against the gold standard, which is, polysomnography, a true sleep study, to say how well it correlates with light versus deep sleep. And the other thing that kind of bugs me as a sleep nerd is, when they say light and deep sleep, what the heck does that mean? What the heck does that mean? Because in my mind, deep sleep is N3 sleep. Light sleep is N1 sleep, and actually REM sleep. REM sleep is a light stage of sleep. That's why we oftentimes wake up out of REM. If you looked at my brainwave patterns while I was in REM, it would look like I was close to being awake. It's really a fast, active brainwave activity. But that quote unquote light stage of sleep isn't really important to your brain. And so even though it's a lighter stage, it's a great a great stage of sleep to be in. So when your tracker is like, oh, deep and light, I really, even as a sleep doc, don't really know what to make of that.
Oh, that's interesting. My dad is always like, you need to listen to some music before you go to bed so you make sure that you get into your deepest sleep pattern. He watches a lot of YouTube videos, and he doesn't listen to me.
Is that what the YouTubes are telling people to do?
Yes, it is telling. Sort of the beta waves or something like that.
Yeah, you can't hear medical stuff from your own family. I can't even tell my own family about it. My parents are like, you want to sleep train your children? And they're like, you can't do that. I'm like, well, I kind of wrote a book about this. No. Yeah. So there's a lot of stuff out there about how to maximize your deep sleep. And I'm a bit of a purist when it comes to sleep for adults. I'm like, I try to peel things away instead of trying to add things and, supplements and, fancy cold plunges and all this stuff that people are doing. The brain has been able to sleep for eons, and, you don't need your Apple Watch to tell you how to sleep. You don't need your Oura Ring to tell you how to sleep. And sometimes the more attention we put into it, the harder it becomes to sleep. There's actually, they've coined a term called orthosomnia, which is becoming so obsessed with your trackers and your devices, the number that it's giving you, that you become anxious and actually sleep worsens. So there's like a balance here, So as a sleep doc, I'm like, sleep is important, but not so much that you're going to lose sleep over it, right? It's that fine kind of balance that you have to have.
I want to talk, you've kind of alluded to a little bit of things here. And so I want to talk like the before and the after of sleep. And so sleep hygiene is a pretty big buzzword in terms of making sure, I guess, that you're well set up to sleep. And then you talked a little bit about like the wake up stage. And so could you tell us about, first, let's start with sleep hygiene. Like what kind of things should people be doing to wind down? What should they avoid? What should they do in order to kind of get ready and have the most effective and restful sleep possible?
Sure. Well, in taking it even a step further back, I'll tell you that people some people are like, well, what is sleep hygiene exactly? And it's essentially anything in your environment or in your behaviors that can help or hurt your sleep. And, sleep hygiene, there are a couple of core pillars. One is having a nighttime routine, trying to keep your schedule the same, making sure your environment is comfortable, calm, and cool, usually 68 to 72 degrees if you're an adult. Trying to avoid things that will disrupt your sleep, excessive light exposure, caffeine exposure, nicotine, alcohol. These are all kind of the core pillars of good sleep hygiene. And giving yourself adequate sleep opportunity, in bed, trying to exercise during the day. These can all be counted as part of sleep hygiene. There's no universally accepted definition of what ideal sleep hygiene is. Sleep hygiene is a great fix for folks that have poor sleep hygiene. Right. And some people get frustrated because they're like, I've done everything that people are telling me regarding sleep hygiene. I still can't sleep. Well, I'm like, well, that's just the foundation. If you're doing something wrong with sleep hygiene, you want to fix it. But then there are many, many things that we then build on top of sleep hygiene issues, such as insomnia. Sleep hygiene is not a cure for insomnia. It's not a cure for delayed body clock. It's not a cure for sleep apnea, of course, and restless leg. So lots of things to consider after the sleep hygiene phase.
And then
sorry, go ahead. Yeah.
Just a side note, so 68 to 70 degrees in Fahrenheit for our Canadian listeners is 18 degrees Celsius. Just wanted to add that little side note in.
Yes.
Good to know.
Yeah. Thank you, Shaz. That's important. I was thinking the same thing. I was calculating 9/5 to minus 35 or something. Can you tell us with the sleep hygiene piece? A lot of people ask about naps. And I know that some people can nap and some people can't. What is your experience and how do you guide your patients through that?
Yeah, my experience is if I could take a nap, that's great. Naps, there's no one size fits all regarding whether naps are appropriate or not. They are great if you have acute sleep deprivation and you need to catch up. By all means, take a nap. Enjoy that nap. If you have insomnia at nighttime, nap will take away your sleep drive. This increasing drive to sleep the longer you're awake, which is modulated mostly by the buildup of adenosine. And that can make it harder for you to sleep at night. So if you have insomnia and you struggle to sleep at night and it's frustrating, we usually recommend avoiding naps. Now, if you do take a nap, there's also science around, well, what's a good time to nap based on, your body's sleep cycles and the timing of sleep cycles. So typically 20, 30 minutes is a good time to think about, or like a full 90 minutes where you're going through a full sleep cycle. If you wake up in between, people usually complain of feeling worse. They feel groggy and may have a headache, and that's that sleep inertia. And it's not that nap won't help you. You'll likely still get the benefits of that sleep later on in the day, but right when you wake up, you're going to feel kind of miserable. So something to think about. Okay.
That's really helpful because as a shift worker, I do kind of nap a lot here and there when I'm sure when I'm low on sleep from my nighttime sleep. But
yes,
I try not to kind of push it too late in the day for the reason that I then feel like I can't sleep when it's bedtime sleep.
Yes. Yeah. You got to time it appropriately. And you also want to have a good chunk of time between the end of the nap and your onset of sleep at nighttime to rebuild that sleep drive.
Mm-hmm. Can you talk a little bit about sleep aids? So, we talked about sleep hygiene being the foundation and then things being added to that. There's, a lot of buzz around a lot of different things that can, are touted to help you sleep. So things like kind of cannabis, CBD, melatonin, alcohol is a big one, magnesium. So can you talk about those things?
Yeah. Do we have 7 hours? Each of these is an entire hour-long discussion in and of itself. I will tell you that sleep aids have their place. There are prescription available sleep aids that can help. But interestingly, the data when it comes to helping with insomnia, people that suffer from insomnia, when you look at cognitive behavioral therapy for insomnia, which is kind of the gold standard, and you compare that with sleep aids, medications, long term, CBT actually wins. CBT has been shown to be more effective long term than relying on solely medications. And for some people, they can do a combo to help them on the right path. Now, what sleep aid you're going to use, the challenge here is that most of the sleep aids, I would say, are prescribed outside of the sleep medicine clinic. Because by the time you get in the sleep medicine clinic, we're usually referring you to our sleep psychologist or other sleep professionals that can help you with CBT, as opposed to saying, oh, you need some Ambien, you're Ambien deficient. And many of us would consider it a failure to consider medication before we consider those other strategies. There is data on all the things that you mentioned. There's some amount of data. Melatonin has great data for shift work, for jet lag, for delayed circadian timing. So for your teenagers that are super night owls and just can't wake up in time for school, melatonin is great as a clock shifting agent. It's not so good as a sleep inducing agent for otherwise healthy people. I could talk a long time about magnesium, but magnesium has become like the new go-to. Like it's like, we go through cycles like, chamomile and lavender and valerian root. Now magnesium is what's out there. The hype is completely out of whack with the actual data. We're not really, people are like 95% of people are magnesium deficient. No, they're not. You guys check these labs all the time.
No, they're not. Like they're real. I check magnesium often. In the Emerge, I do.
Oh, in the Emerge, you do, yeah.
Yes, but unless you're like chronic alcohol use disorder or some other like kidney wasting disease, or malnutrition, very unlikely to have a low magnesium.
Even in the critical care population, the rate of magnesium deficiency is it's there, but it's much lower than people are touting amongst the general population. And so, I think if it's working for you and you're not spending all of your savings on it, you're not taking too large of doses that put you at risk of other things like heart arrhythmias, et cetera, and toxicity, if it's working for you, I don't argue with success. But the data behind using magnesium is very limited. And there's zero data to support using it in children.
What about cannabis?
I was going to ask.
Yeah, we're both Sheila and I are both on the same page.
Yeah, we both are. So yeah, there's magnesium lotion, there's magnesium baths. People are drinking it. It's all over the place. But what about cannabis? We both are curious, asking for friends.
Like I have a lot of people that come in, like when I'm seeing people in Emerge, when I ask them what their medications are and then ask about supplements as well, they do say that they're using either CBD or cannabis specifically to help them sleep. So I'm definitely curious to hear what you have to say about that.
So, first of all, a lot of the studies that were done, the bigger studies were back in like the 70s and 80s, and it was just on straight up marijuana. It wasn't on like, just the CBD portion and not the, THC. Right. It was just marijuana. And it's shown that it can decrease sleep latency, the time it takes you to fall asleep. But marijuana is a REM suppressant. It actually decreases your amount of REM sleep. And so for folks that will have stopped using, one of these marijuana derivative, they'll say, wow, I had like the most vivid dreams and the wackiest dreams. That's because your brain is now in REM rebound. It's actually getting the REM that it was lacking while you were taking the marijuana. So it's a REM suppressant, and we know REM sleep is important for a variety of things, and so so that's why I don't recommend it for my children that can't sleep. It's not something that I typically say that's your go-to. Now, marijuana can be treating lots of other underlying issues that might then benefit sleep, and we know sleep is an amalgamation of so many things, but maybe you have anxiety that's contributing to, daytime dysfunction and sleep. And now you might be treating some of that and makes it easier to sleep. And so it's hard to know unless you sit down with a person, talk to them for an hour and tease apart where it's actually helping. But yes, it can. In some people, it does help them fall asleep. But again, at the expense of suppressing REM sleep.
That's true. It's interesting. I appreciate that because a lot of our patients do come in using it very regularly. I'm a family doctor, so it's interesting. You mentioned anxiety being one of the causes. And so when we're working with our patients around sleep, we are looking at the underlying causes that could be contributing, like sleep apnea, restless leg, pain that might be contributing to them waking up in the middle of the night. Can you walk us through a little bit around medical conditions that may be affecting sleep? Sure.
Yeah. There's so many things, and this is why when I get that MyChart message or that epic message from a colleague saying, hey, this child is asleep, should I give them melatonin? I'm like, I don't know, give me an hour with them in clinic. It takes me an hour to figure out for most kids. This is also why I can't answer, for a variety of reasons, I can't answer these DMs I get on social media regarding my kid isn't sleeping. Tell me what I can do. I'm like, I don't know. So medical conditions, we know certainly pain conditions, things like eczema in the pediatric space skin conditions that cause itching can be a huge disruptor. We know that if you have a heart condition, for example, it can certainly affect both your comfort with sleeping, the position in which you're sleeping. We know having back pain or other musculoskeletal pain from injuries will certainly disrupt your sleep. Almost any medical or psychiatric condition can contribute in some way to worsening sleep. And worsening sleep can contribute to almost every medical or psychiatric condition.
Right.
So it can be kind of this vicious circle. When it comes to sleep-specific medical disorders, we think about what you already mentioned, which is sleep apnea, certainly disrupting the quality of your sleep with frequent blockages in your breathing as you're trying to sleep. And we think about the sister diagnosis of restless leg. So restless leg is what you experience clinically. That is sensation you move your legs. It helps when you move. It worsens when you stop moving. It's worse or only occurs at night. That can prevent you from falling asleep. But the sleep disruption is usually due to periodic limb movements of sleep, which will happen after you go to sleep and your legs are moving just a little bit throughout the night, waking you up. So that's another medical issue that can disrupt the quality of your sleep.
So Sheila does a lot of women's health. We have also had an entire episode on perimenopause. Sheila and I are both in our 40s. And so certainly a topic that's important to us, and I think a lot of our listeners. And so can you talk to us about how hormones affect sleep, and in particular perimenopause going into menopause, what sort of effects on sleep we can see?
Yeah, this is a huge topic, and I will tell you that I'm by no means an expert in this topic, and there are many other people that treat this topic with the diligence that it deserves. I'm in the pediatric space, and so I'm usually not dealing with perimenopausal situations. But the things that I will tell you, the important thing is, yes, it's a huge disruptor and can be a huge disruptor of the quality of your sleep. Interestingly, we feel that for women, prior to menopause, there's something that's likely protective, perhaps about estrogen, that keeps the rate of sleep apnea, obstructive sleep apnea, lower compared to men. And by the time you hit perimenopause and postmenopause, that rate actually equals out amongst men and women. And so we think that your risk of having sleep apnea likely rises around that time. So something to be wary of. We think maybe it's protective with the muscle tone of your upper airway, et cetera. But that, along with all the other symptoms that can occur as part of perimenopause and the hot flashes and other forms of discomfort, can certainly disrupt the quality of your sleep. Now, this is worth a frank conversation, because people are like, oh, well, it's just perimenopause. I have to go through it and I have to suffer. This is worth a frank conversation with your physician regarding what options are available, because there are available options to help get someone back on track with their sleep and overall health if they're experiencing severe symptoms. So
thank you for saying that. I love that's such an important piece. We've undertreated women for perimenopause and menopause symptoms for decades. And so this is such an important, people don't have to suffer through it. There are options. We touched upon cannabis, but we didn't get to alcohol very much. And often people will have a glass and say, that's my nightcap and I need that to go to sleep. Thoughts?
Yes. So this is interesting too, because the more you dive into the data, the more nuanced it starts to get regarding, how much alcohol and how chronic of alcohol use. And then and so, the party line amongst all sleep docs is that, alcohol is a net negative. And I tend to stick with that party line. It's a net negative on your sleep. And the reason people sometimes feel like it's helping with sleep, because it does decrease your time to fall asleep. It decreases your sleep latency, how many minutes it takes you to fall asleep. So people think, it must be helping me. Now, the difficulty is that although it helps you fall asleep, during the second part of the night, you're actually withdrawing from the alcohol. So then you start getting sleep fragmentation during that second half of the night. You end up spending less time in deeper stages of sleep. And we think you likely wake up earlier than you would otherwise because you're having that withdrawal effect. Now, many people wake up, depending on how much you drank, and have that sense of energy in the morning. I feel really good. I woke up after 6 hours. I feel really good. That's likely the rebound phenomenon. Alcohol suppressed or depressed your CNS, and now you're seeing a little bit of that rebound from that phenomenon. And then as the day goes on, you realize, maybe I didn't sleep so well, because then you start to feel like crap. And that's because you had likely sleep fragmentation and didn't get the adequate length of sleep that you needed. Not to mention having to use the bathroom multiple times and alcohol being a diuretic and all the other things that can contribute. So back to the party line, please do not use alcohol to help you sleep. And please do not be fooled into thinking that alcohol is helping you with your sleep problem. It's a bad slippery slope. Yeah.
And so absolutely. You definitely don't want to use it to fall asleep. I mean, what if you do want to have a glass of wine or enjoy a glass of wine or cocktail? Are there any things you can do to help mitigate the effects of alcohol on sleep, in terms of timing or that sort of thing?
Yeah, as a purist, I would say your goal is to go to bed with a blood alcohol concentration of 0.00, but people have to live their lives, and I totally get that too. And so I'm not going to come here and finger wag and say you can't ever go to sleep with alcohol in your system, but the earlier and the less alcohol you can put into your system, the better off your sleep is going to be. Oh, and we didn't even mention sleep apnea. It decreases your upper airway tones. You're much more likely to have obstruction while you're sleeping. And so if you needed another reason not to drink alcohol, you just got one.
Or at least keep it away from your partner that you're sharing a bed with, maybe.
I mean,
yes, absolutely. Yes. We should talk about that, man, like sleep divorces and all the stuff that happened. We should go into.
I mean, that's really interesting. So I almost divorced my husband last night at 1:00 in the morning because I was taping him snoring because he actually had a drink last night, and I said, oh, the last few nights you haven't had a drink, and I've noticed that you were snoring more, and so it's interesting with the floppy airway. But people are sleeping separately a lot now, and there's sort of a lot of. That's a new thing, or it's happening, it's an old thing becoming new again.
Yes.
Are you seeing that as well? I've seen it in my practice. People are sleeping better when they have sleep divorce.
Yeah, not many of my pediatric patients are married, but
right,
I will tell you anecdotally, yes. There's some data like about a quarter of married couples are now sleeping in different rooms or in different sleep surfaces. I think it's been around a lot, but we've kind of stigmatized it a bit. Be like, oh, there must be problems in paradise if you're not sharing the same room. And really, people are just prioritizing their sleep, which is totally okay. If both of the partners in this relationship are okay with this, and they feel like they're getting great sleep, many people say it's the best thing we've done for our relationship, But again, it's that frank conversation. It's the communication to be like, listen, let's make sure we're both on the same page, because if one partner is okay with it and one is not, this is also a ripe area for conflict. So yes, it's okay if you both decided to do it. But I also take a step further and say, well, why are you doing it? Like, what's the problem? What's the problem? Because there are sleep disorders that need to be treated, that need to be treated that you should not ignore. If you as an adult are snoring regularly, heavily snoring regularly, your chances are about 50% of having sleep apnea. If you and your bed partner snore, well, based on the math, there's a 75% chance that at least one of you has sleep apnea.
Right.
And so you got to be really kind of careful to be like, oh, I'm just going to separate and that'll solve all the problems. Well, no, your poor bed partner is going to be apneic all night and you're not going to be able to hear them and be like, you need to go get a sleep study because you're not breathing at night.
Do you have any suggestions? I know you work with the pediatric population, but in my practice, when I try to suggest a sleep study, patients really struggle with it because it's uncomfortable for them. They know they're like, I won't be sleeping in that space because it's uncomfortable. Yes. What's even the point? How do you talk your patients through that? Because I do find I always offer it, but there's a lot of, I don't want to do it.
You're absolutely right. There's a lot of pushback. And I always start by telling people that a sleep study is not a sleepogram. It's not meant to diagnose everything about your sleep. All we're trying to do is get into the different stages of sleep for an adequate amount of time to see how you're breathing. And even if you wake up 5 times at night, it's okay, as long as we're seeing those stages of sleep that we need to see, ideally with you in the position that you like to sleep in, and particularly on your back, because that's what worsens sleep apnea in most cases. And so we just want to see some good hours of sleep from you. And it's not going to be the perfect night, and we know that.
Thank you.
But how your airway reacts that night should be similar to how it's reacting at home. In the absence of, elevating your head a different level or household allergens that are bothering you at home and not in the sleep lab, things like that.
Right.
Can you tell us about what your thoughts are on phones and screens in bed? I'm pretty sure I know what your answer is going to be, but I myself am guilty. Like my phone is my alarm clock, so it sits next to my bed, and it's often the first thing I check in the morning. So
this might surprise you a little bit, but I think we are over time learning more and softening our stance a bit when it comes to light exposure at nighttime. Now we know that light, the intensity and the duration of light, can diminish your brain's natural melatonin. But there are folks out there that, they're on their phones, that are checking email or watching some videos. They put their phone down, fall asleep fine, and wake up fine the next day without really any kind of detriment to their sleep quality. And if you're in that category, I don't think anything's broken. I don't need to come in there and fix it for you. For me, it's the situation in which, because phones are so addictive, you're naturally spending more time in your bed awake than you would if you put that phone away. Or the content you're consuming is so exciting or interesting that it prevents you from winding your brain down. So, I'm starting to get a little bit less concerned about the light exposure, but more so about the addictive nature, the content you're consuming that's preventing you from getting an adequate quantity of sleep. But if you're good about putting it away at the right time, you can fall asleep fine, and you feel like the quality is good, your sleep isn't broke.
Oh, that's interesting. Because I fall asleep watching TV, and I'm like, oh, maybe I should watch TV in bed, but I don't. But it's interesting because I feel like a level of sleepiness, and it helped. I think it just shuts my brain off, which is obviously my own anxiety or whatever else that's needing to be occupied.
Yes.
But it's interesting. That's an interesting thought.
My goal for people is when you actually go to sleep, go from wake to sleep, that you've done so ideally without anything in your environment that's not going to be there if you were to wake up in the middle of the night, because we all wake up at nighttime. Waking up is a totally normal part of sleep. Every human being wakes up at night, whether they remember it or not. And if you wake up and that same thing that you fell asleep to is not there, it makes it a little bit more challenging to go back to sleep. That's where all that challenges with older infants and toddlers come into play, the difficulty going back to sleep.
So one last question before we kind of wrap things up. Caffeine. So I know you've done some videos on this. I like to have a cup of coffee when I wake up at whatever time I wake up, depending on what time my shift is at the day before.
Yeah.
What is your advice on caffeine? How much? When to stop?
Yeah, this is also, it's a challenging, no one size fits all, because we all metabolize caffeine a bit differently based on our, CYP enzymes sitting in our liver. And, the typical half-life is 4 to 7 hours for adults. So that's challenging, because if you're a 7-hour half-life caffeine metabolizer, for me, if I drink coffee in the morning, if I were to have half a cup of coffee, I can feel it. Like I have trouble falling asleep at nighttime. Like it makes a difference for me. The older we get, we think we also metabolize it more slowly. So I encourage people, experiment with this. If you feel like you're not getting adequate quantity of sleep, if you are finding that your quality may be disrupted because you wake up always feeling super tired and miserable, I say try to slowly give up caffeine and see how you do. And you might be surprised. I'm pretty certain that many people are in this caffeine, poor sleep, need more caffeine, death spiral. You're so reliant on caffeine. You're like, I just don't feel normal without it. Well, is it because the caffeine is making you not feel normal because it's disrupting how well you sleep at night? And then you wake up thinking it's the caffeine you need, or it's actually the caffeine that actually got you in that position in the first place? I say experiment. This is like the most used psychoactive stimulant in the world. And just because everybody uses it doesn't necessarily mean that your brain needs it.
That's super helpful. So much information. Thank you so much, CJ. This has been incredible. One of the ways that we always end our episodes on the Doc Talk is with a prescription for our listeners. So we'd love if you could share with us what your prescription would be for one or two top things you'd recommend to people to improve their sleep.
I would actually prescribe a sleep challenge to you. I would prescribe you a sleep challenge, which is for 2 weeks. I mean, just give me 2 weeks. For 2 weeks, and I know some people this is not feasible because of job, being parents, etc. But for 2 weeks, if you feel like you are sleep deprived, right, and you can fall asleep pretty easily at nighttime, try to give yourself more sleep than you think your body needs, just for a 2-week time frame. And that, I like to say, maybe 9 hours is a good place to start. 9 hours of in-bed sleep opportunity. Try to minimize caffeine and just see how you feel after 2 weeks. And I'm pretty certain that many people will realize that the world actually looks much different and your mood is much different. The birds sing louder and the colors are more vibrant when you're actually getting the sleep that your brain needs and deserves. So let's get you out of this fog that you're experiencing human consciousness in and get you experiencing how it was intended to be experienced, with a well-rested brain after a full night of sleep.
I love that.
That makes me want to cry. Thank you.
I know. It's like, I feel it right here.
This is why I do this. Sleep can be life-changing for many people. That's why I do this. That's why I love sleep. It can really change your life. So
thank you.
Try it. Give me 2 weeks. All right.
Well, thank you so much for joining us on today's episode. I've learned so much. I feel like I want to do CME credits for this because I've learned so much. Can you remind us, Sujay, where can people find you on your channels?
Anywhere where social media is consumed, which is funny for a sleep doc, right? But that sleep doc is who I am. Sign up and I'll remind you to sign off of social media from time to time.
Beautiful. So thanks for everyone for listening. Thank you, Sujay, for joining us today. We want to remind everyone that the Doc Talk is for general information purposes only. This podcast is not intended to replace medical advice from your doctor. While we are doctors, we are not your doctor. So always speak to your own healthcare provider for questions related to your own personal health needs. A big thank you to our sponsor of today's episode, Always Discreet. You know, Shaz and I know that our patients will often share that if they sneeze or laugh too hard, or even during a workout, there can be bladder leakage. There's no shame in this, and there are solutions. Please know that you're not alone, and there's no need to worry. Always Discreet is here for you. Many women experience urinary incontinence as they go through perimenopause and menopause. Nearly half of us may encounter leaks or accidents during this time, and by age 65, about 75% of women report experiencing some form of urine leakage. Yet it's a topic that we rarely discuss.
Always Discreet's rapid dry core locks away even the biggest leaks with no wetness, no odor, and no visible lines, allowing you to stay active and confident. They stay in place comfortably and remain invisible under clothing. Check out the link in the description for an Always Discreet coupon and step confidently into this new chapter. Always Discreet, your dependable solution for bladder leaks.